Have you ever been told that the food that you grew up eating wasn't healthy? Yeah, me too. And for years I believed it. But what if the problem isn't the food, it's the framework we've been taught to judge it by? Hi, my name is Tamisha Campbell, the founder of Enhance Black Women's Health. And I'm a health writer, coach, and educator who's dedicated to advancing health equity and supporting underserved communities, especially Black women, navigate a healthcare system that wasn't designed with us in mind. And in today's video, we're talking about something that doesn't get discussed enough: how cultural erasure sneaks onto the plate and what we can do to reclaim the foods we were taught to fear. Whether you're a clinician, a coach, or a health educator, this is for you. We're going to explore the harm caused by one-size-fits-all nutrition advice and how culturally relevant teaching can help us do better for our clients, our communities, and ourselves. Now, let me take you back for a moment. My grandma, Lula Mae, hands down was the best cook in the family. Our kitchen was filled with baked mac and cheese, fried chicken, collard greens, and sweet potato pie, my favorites. And these meals were more than just food. They were love, they were celebration, and they were part of our tradition. But when my grandparents started getting sick, we were told these foods were unhealthy, so we stopped making them. One by one, these dishes disappeared from our plates, replaced by foods we didn't grow up with, all in the name of health. At the time, I didn't see it as cultural erasure. I saw it as doing what we needed to do to live longer. But by the time I became a certified fitness nutrition coach in 2016, I had fully bought into the idea that the Mediterranean diet was the gold standard. I avoided white rice, collard greens, and cornmeal like they were dangerous, but something never felt quite right. Fast forward to 2019, I was diagnosed with rheumatoid arthritis and Sjogren's syndrome. And that's when I started to really question what I believed about food and health. Number one, the problem isn't the food, but the framework. We've been taught to see certain foods as good and others as bad without understanding the cultural context. But brown rice isn't inherently better than white. Kale isn't superior to collard greens, and quinoa doesn't automatically replace cornmeal. The problem is the bias baked into mainstream nutrition. 2, culturally relevant teaching matters. Through my master's in sustainable international development, I learned about the social determinants of health. These are things like access to quality healthcare, safe neighborhoods, and culturally affirming care. And when we ignore these factors, we're not educating, we're erasing. And 3, we can't assume everyone has the same starting line. My grandparents' doctors encouraged them to eat healthier, but didn't consider their lifestyle, their tradition, or their access. When their health didn't improve, they were blamed for not trying hard enough, but the advice itself didn't fit their reality. If this message resonates with you and you want to provide nutritional guidance that respects culture instead of replacing it, make sure to subscribe to the Enhanced Black Women's Health YouTube channel. Enjoy our growing EBWH community newsletter. The links are in the description box below. So thanks for watching, and together we're going to rewrite the rules and bring culture back to the table. See you in the next video.